Thank you, everyone, for joining us today. And this, for me, is a very topical presentation on ageism. And so I'd like to present Margaret Coates, who has over 40 years of experience in the nonprofit sector across Metro Vancouver, with 28 years focused on working with seniors. In her last full-time role, she was the executive director of the 411 Seniors Center Society, and she worked there for 15 years. Since 2015, Margaret has been working for Lions View Seniors Planning Society, where she also writes a column for the North Shore News. Over the years, Margaret has served on several committees and boards as volunteer. To name a few, she was on the Social Planning Advisory Committee for the City of North Vancouver for 6 years and on the board of North Shore Keeping Well Society for 5 years. Margaret presently serves on the board of Silver Harbor, and it is a member of the Community Housing Action Committee run by North Shore Community Services. And Margaret is a longtime resident of North Vancouver, or the North Shore, is married and has 3 children and 9 grandchildren. And so please welcome Margaret for this presentation today. Thank you, Margaret.
Thanks so much, Candace. I got interested in ageism mainly because I'm an older person, and I think even since my 60s, I've felt like I've experienced ageism. And last year, Lions View Seniors Planning Society hosted a panel or a group to talk about ageism, and that was very popular. A lot of people attended, but this was on behalf of the provincial and federal governments who were exploring the whole topic of ageism. So out of that came a column that I wrote, and then I did a presentation to a group of 90 men, which was really interesting, being the only woman in the room. And I wasn't too sure how that was going to go over, but it went over really well. So I have some slides, and I'm hoping I'm capable of switching to the next one. Yep, there we go. So I just want to say thanks for letting me present to you. It's great to do that. I came up with one bit of information that my slide, I can't read it, but anyway, I looked at a bunch of statistics here and there just to sort of set the context for this presentation. So I looked at the 2021 census data for members of the Canadian Armed Forces, my father being one of them, and my mother-in-law being a member of the UK forces. Anyway, those stats show that there were 97,625 Canadians serving in the CAF in the spring of 2021 as members of the regular force or primary reserve force, and 400,061 Canadians counted as veterans. And there are more than 4 in 10 veterans aged 65 years and older in those shown in that 2021 consensus or census. I know my voice might be warbling a little bit. I'm just a little nervous. So I also looked at some slides regarding British Columbia demographics. So as you can see from the pie chart, anyway, BC population 2023 shows the 500,581,127 seniors, and then BC seniors over 65 and over is 20% of that, and BC other ages is 80%. So there are a lot of seniors over the age of 65, and I think that the trend is showing an upward movement. So So data released by Statistics Canada in 2022 found that people 85 years of age and older are the fastest growing age group in the country. And just as a fun fact, we noted that BC is also home to 7 municipalities with the oldest populations in Canada. That would be Qualicum, which has more than half of its population is 65 years and older. Asoya, Sydney, Parksville, Southern Gulf Islands, Nanaimo. So Nanaimo, East and Nanaimo. So it looks like the Vancouver Island is a real magnet for seniors. And let's hope that they're not experiencing too much ageism there. I mean, maybe with that big a population, nobody can do it. So the last presentation I did was in West Vancouver, and as you can see that there's a number of seniors in West Vancouver. By the pie chart, you can see that it's almost half of seniors. So part of my screen is covered because of people, so I'm not too sure how that's working. Okay, I got my techie person here now, so that's great. So what is ageism? And there's the World Health Organization describes it. It's stereotypes, prejudice, and discrimination. So it's stereotypes is how we think, and prejudice is how we feel, and discrimination is how we act towards ourselves, to others, or oneself based on our age. And it's been found that ageism can do real harm to seniors. It's absolutely rife in our society, according to the World Health Organization. 1 in 2 people are ageist when it comes to older people. And unfortunately, this includes seniors who have internalized stereotypes about older people. Just in the last week or so, I've been in Chilliwack. I'm tending to a brother who's unfortunately died, but a lot of family and a lot of friends were around, and I noticed that people were, remarkably being ageist, even though they were older people themselves. So it was quite amazing to me to be in that situation. So why is there ageism? There's a lot of myths about ageism or aging. Stereotypes and false assumptions about older people underlie ageism. I don't know if people here on this call have heard talks by the BC Seniors Advocate Isabel McKenzie, and she can go on forever about myths and stereotypes about seniors. So older people are often, this is one myth, older people are often assumed to be frail or dependent and a burden to society. But as stats show, only a small percentage of older people live in care facilities. So Isabel McKenzie's admonition to everybody is that seniors should prepare to live a long life, and most of it independently at home. And the stats show that seniors living in their own home are 94% are over 65 and 74% are over 85. So again, a wrong perception. Older people are often thought to be declining in physical ability, making them a burden on society. And of course, as we age, our minds do change, and we might even experience memory loss. But seniors adapt to the aging process. Mental capabilities can be sharpened by staying mentally active. So, I mean, I don't know about folks here, but when I get up every morning, I do a crossword puzzle and a read chapter in a book, and a few games on my iPad. So I'm hoping that's gonna keep me thinking clearly for as long as possible. So there's a myth that dementia is an inevitable part of aging, but stats have shown that from Alzheimer's Canada have shown that only 7.1% of the total seniors population of Canada has dementia. So, you can see by that pie chart there. I think I missed a bit about the losing their physical capabilities, and seniors do adapt. Through the loss of physical capabilities can be compensated through assistive devices such as hearing aids, eyeglasses, and walkers, and through modifications of the older person's environment. So our bodies do change, and we might, as I said, lose those physical abilities. So another myth is that seniors are not productive in society. Well, many seniors, me included, continue in paid work, and we do it because we want to, or some seniors do it because they absolutely need to, which is too bad. But our pensions and our OAS aren't always exactly what we need to live in this society, with this, our increasing costs. Seniors are productive in that they contribute the most volunteer hours in Canada as a group, and we all know that. We volunteer as unpaid caregivers to friends and family. When we save the economy thousands of healthcare dollars by doing that. In fact, as I said earlier, I was here in my family's home, and my brother, my one brother was the unpaid caregiver for my other brother for 6 months, and it's was paid quite a toll on him, but he was able to do it, and he saved the economy. And seniors have paid taxes. We still pay taxes, darn it. And we're consumers of goods and services. If you walk into a Tim Hortons on a 9 o'clock on some mornings, you'll see a lot of seniors buying coffee and having a muffin, etc. So it's not like we don't contribute to our society. So seniors and volunteering. In an address on the International Day of the Older Person in 2019, Isabel McKenzie said, there are literally hundreds of thousands of seniors throughout this province volunteering to deliver meals, provide rides to medical appointment, raise money for hospital foundations, and maybe an organization like TV Vets. They lead chair yoga sessions, and they visit those who cannot get to the senior center. And without this selfless donation of time, government would be spending close to $1 billion more each year on services. So seniors are an extremely important part of our society. Another myth that really probably drives me the craziest is this one, where older people are thought to be resistant to change. And change is inevitable for all of us. We know it. Seniors had successfully lived through amazing changes. We were just, my family were talking about this, the strides in technology that lots of us have had to learn. Men on the moon, wars, recessions, upswings in the economy, and pandemics. We've lived through all that successfully. And I think that when the pandemic came up, COVID, I noticed seniors pivoting to, their way of living to another way of living, and some seniors have adapted to technology in ways that they never thought they would before. So I think that myth about being resistant to change is just so wrong. In terms of the recent pandemic, adults age 60 and up have fared better emotionally compared to younger and middle-aged adults. I found that in some research published in the Journal of Gerontology. and psychological sciences. So we did really well. Another myth, older people are often thought to be unable to learn new skills, such as using computers or tablets. So over the last few years of the pandemic, many older people learned how to use technology to stay connected to community. For example, they went to Zoom fitness classes and caregiving support groups, both of which are still popular today. I've joined a virtual class about a year and a half ago, and I think it's absolutely great. It means I just get up in the morning and put my sweats on and turn the TV or my computer on, and there I go. So for me, it's great. And for the others in the class, they tend to like it too. And plus, this class is joined by several people from different communities. So in our class are people from North Van, Mission, the island, and throughout the province. So it's kind of fun that way too, because at the end of the class we touch base and talk to each other about different things. So Lions View Seniors Planning Society has and the City of North Vancouver Library have been running Tech Connect training for seniors, and sessions are always fully booked. People are pretty excited about it. They can bring their phone or their device, and trained volunteers will help them set things up or take text if they haven't learned how to text and that kind of thing. So other technologies such as smartphones, wearable devices like watches, which monitor our exercise programs, and tablets are increasingly being used by seniors. Just a chart that we found is the internet used by seniors age 65 and older, selected across data points 2007 to 2016, has showed quite a remarkable change in the use of technology. So that busts not only the myth about us being able to learn as we age, but also that we can adapt to change. And then another myth is that older people are all the same, and seniors are just not a homogeneous group. There are many types and varieties in the seniors population, as there are in younger age groups. Canadian government website says that Canadian seniors have multiple identities and experience life circumstances that make broad generalizations problematic. And the seniors advocate, again, she said, the only thing all seniors have in common is that they are all older than the rest of the population. And again, if you've ever been to one of her talks, one of her Isabel's stories is about two young women in their early 20s, one as a kind of a stereotype mom, stay-at-home mom, and one is a hippie person just having a great time, and they both go into the same care facility. But because of this myth that all older people are all the same, the care facility sometimes treats them as though they're exactly the same when they're not the same. So we had, before some of us, that small percentage that gets to a care facility, we need to change the minds of these people, let them know that we're all different. Sometimes seniors' contributions in society are overlooked. People forget that seniors contributed to the building of this country and community and world. Seniors contributed to the economic and social growth of their communities through their paid work, taxes, and their contributions to culture and Canadian values. They created systems like the National Healthcare System and pension plans, and organizations such as universities, schools, museums, and libraries, which help all Canadians live improved lives. And seniors contribute to the fabric of our community in as many ways as younger generations do. Sorry, I'm just looking at here we go. So the World Health Organization says that ageism is harmful and costly Ageism, they say, has far-reaching impacts on all aspects of people's health and their physical health, their mental, and their social well-being. Ageism intersects and exacerbates other forms of disadvantage, including those related to sex, race, and disability. And ageism takes a heavy economic toll on individuals and society. And these are if you go to the World Health Organization's website, you'll find more detailed information about that. So what are some of the effects of ageism? Compelling research shows that ageism has detrimental effects on the health and well-being of older Canadians, as I said. Negative age stereotypes, for example, have been found to be associated with a greater likelihood of future hospitalization, poor hearing and memory, and early biomarkers for Alzheimer's. Older people can also be infantilized and are seen to have decreased ability to make good judgments. Some people treat seniors like children, and often people act like they know what's best for a senior. Whether it is doing an errand or making a financial decision, never assume you know what seniors want. One of the things, I run a group called the Seniors Coalition for the Lions View Seniors Planning Society, and a lot of the people that attend these meetings are professionals who do programming for seniors, and some of them occasionally, except when I admonish them not to talk about seniors like they're kindergartners, saying things like my seniors, and I'm sitting there as a senior thinking, I'm not anybody's senior. I'm just a person. So social stigmatization or stereotyping of older adults can reduce an older person's access to services and opportunities. Communities and individuals must provide the support seniors need while at the same time not stereotyping them. So dispelling myths and stereotypes. So whether it's about ourselves, our friends, or our community, we excuse me, we need to reject misconceptions about older people. So anytime that you, I think I was just earlier on this call, I was just talking about being on a ferry and a TV was behind me on the wall, and a person walked by, probably my age, and said, Biden was talking, and he said that person should go and sit back in his rocking chair. And I just said, that's ageist, so I think we need to do that. We need to call people on those things. There are changes that come with the aging process, but our discussions about aging need to be evidence-based and not rely on stereotypes and misinformation. And age is really merely a number. Ability is the key for being productive in our society. So excuse me, the WHO says public health professionals and society as a whole need to address these and other ageist attitudes, which can lead to discrimination, affect the way policies are developed, and the opportunities older people have to experience healthy aging. So I just pulled that off the Fight Ageism. Anything is possible. I found that on the WHO website. So that's my presentation, and thanks for listening. And I hope that you've learned something, and I'm open for questions.
Well, so far there's no questions in the chat box. But for myself, I think it's so true that, when we are caring for a loved one in our home, whether you're a senior and that person's a senior, it was really surprising to hear that $1 billion of social services are saved every year. So we're like your brother did with your other brother. He really saved society a lot of money there.
Yeah. And I must say, there was savings, but also there was, quite a toll on him. And a lot of us do this end of life care without knowing what to do or how to do it. So
Yeah. Yeah, absolutely. And then the other point you brought up is that most seniors live independently right until close to their death, a lot of them. I mentioned to you, my mother was 97 when she died, but only the last 2 years of her life, she lived in a care home where she needed extra help. But the rest of her life, she lived independently, raised 8 children, 30 grandchildren. She was a really productive person and, like you said, volunteered her whole life. And I'm sure I'm not the only one with that kind of experience. I think it's true of so many of us that we've watched our, really resilient parents live through a lot.
yeah.
Here.
I'd like to say something about when you said about the caregivers, and that's so important to be aware of. I was a nurse for many, many years, and people would talk about the patient or the person receiving care as if that, that was the central concern. And I'd watch caregivers, usually family members, go downhill in their health. And it was almost as if people expected that those people would be doing that. And I think there's still an expectation in society for that. Without being aware that we also need to help those folks. I'm a senior in my 70s, and my father passed away 3 years ago, but I was his caretaker. My mother is now 94. She doesn't live with me, but I do a lot of the care for her. And I also have 8 grandchildren. So I'm the sandwich. And we haven't talked about that part. I'm a senior, but here it's like, again, an expectation when people talk to me about my mother. Well, you need to be there for her. And I think, well, I'm getting old too,
Right.
Yeah.
All right, thank you, Maureen. This is a cute comment. Thanks for the presentation. Even an old guy like me needs reminding of this topic. So, and then someone's asking, what's the Lions Senior Planning Society?
Okay, so Lions View Seniors Planning Society mainly plays a coordinating and role in North Vancouver. We coordinate and collaborate so that policymakers, can understand the needs of seniors and that kind of thing. So we run groups. One's the Seniors Coalition, one is the Seniors Working Group. So the Seniors Working Group was set up in COVID, and that was mainly to bring people who work with seniors and seniors themselves together so that they could look at how COVID was affecting seniors and what we could do to help people through that difficult time. Right now, we've pivoted from COVID to looking at climate change and emergency preparedness. So we've run a few projects around emergency preparedness so that folks can get the information they need in order to deal with, say, that hot weather that we had about a year and a half or 2 years ago. So that's mainly what we do. We don't provide services, but we ask people together to collaborate about services.
Okay, I've got another question. Margaret, what practical things can seniors do to reclaim and restore the lost respect given to older people? Other cultures, Asian cultures, place a strong emphasis on respecting and venerating the older people for their wisdom and experience. So do you have some tips for us?
Not exactly tips, I guess, just the kind of roles that I feel that I have to play, in my life to make sure that I get the respect I need is calling people when they are ageist. Just say, that's ageist. You have to understand who we are, that we're people. I call out the at the Seniors Coalition I mentioned before, I call the professionals out who are treating seniors like kindergarten kids, and those are the main things that I think we can do. And maybe other people have suggestions. As I think I said earlier to Candace, I'm not really an expert, only in that I am old or older.
I have another question for you.
Yeah.
As mentioned, OAS and pensions are sometimes too low for people to depend on, especially in Metro Vancouver. Is there any lobbying for seniors programs to increase these amounts?
Yeah, there have been some groups that do that. I'm not involved in them, but I know that there are a few around that that do work on that. Excuse me. Costco, it's not Costco the store, but Costco the organization, and I can't remember what their acronym stands for, but they've been working on pensions. And then there's the pensioners organization, the old age pensioners organization. They've been working on, well, obviously pensions and trying to get those amounts raised.
And then another person mentioned that this presentation is preaching to the choir. We seniors know this, but this myth-busting message needs to be given to and infiltrate the minds of younger generations as well. Who else are speaking about this topic? Are high schools, youth groups, boards of trade?
Well, at this point, ageism has just become a topic of interest to the Canadian government, which I think I mentioned earlier. The provincial and federal government got together to talk about what is ageism and how it's affecting the society and how it's affecting seniors themselves. So they've come out with a report, which I can send you the link later, Candace, but I don't have it here. I'm not at my desk, so at home, so I can't. But anyway, there is a really good established report, and once they've got several recommendations listed in terms of that very question of how we get the message out. So I'll send you the link later.
Okay, that's
and
great.
If I forget, send me an email.
Okay, and we'll share that with everyone on this presentation. Someone is asking if you know if there's a corresponding group in Burnaby to, I think it's like the Lions Senior Society.
Oh, Lionsview seems to be one of the few organizations that that provide this kind of service. There's a group called the Tri-Cities, and they deal with it more or less in the same way as Lionsview does. And I don't think there's anything in Burnaby.
Okay.
And I can send you the link to the Tri-Cities because they're a very interesting group.
Okay, good. There's another comment from Heather. Would be nice if doctors thought more about the patient's symptoms rather than dismissing them as, oh, you're just getting old.
I agree.
It's just it's ongoing. And then as another person has suggested, the 411 Senior Society in Vancouver provides many resources and is developing programs and activities for seniors, and they're located on Fraser, just north of Kingsway. And Margaret, I think did you volunteer with the 411 Society?
No, I was the executive director of the 411 Senior Society for 15 years. So I'm very familiar with it. The government at one point gave the building that we were housed in, which was at 411 Dunsmuir Street, which is one of the reasons why it was called 411. And then the building became just too difficult to operate. And so after I left, it was sold. And they had a temporary location at Van City building I believe. And then they had money to build, be part of the where they're located right now. So. And I mean, as far as I understand, they're a fantastic organization, and they do a lot of stuff around seniors and how they use technology, which is kind of moved away from what I did when I was there.
Another person, Judy, has suggested that we need to ask our the young people in our life to be cognizant of seniors and their abilities. And, you know, I guess it starts with us, that we connect with the people close to us and let them know too that, you know, being a senior does not mean that you're not a productive member of society.
That's true.
And then someone has mentioned that it's Rod, that the Costco, Council of Senior Citizens Organization. That's what the acronym is.
Right.
And then someone had to run off to work, so they say thank you for the presentation. I don't see any more questions in the chat unless anyone else would like to ask a question. Okay, nothing else has come up. So Margaret, I thank you very much. And once again, I'm very sorry to hear about your loss of your brother this week. And just take care of yourself.
Yeah. I'm going to get served a wonderful dinner by my daughters. So that'll be good.
That will be great. I wanted to mention before you go that I'm really glad to hear that you're attending a Zoom fitness class, and the TB Vets also offers one.
Oh, they do?
It's free. It's Wednesday mornings at 10 o'clock. So if you didn't know about it and would like to hear about it, just send us a note and we'll make sure you get added to the list.
Okay, great. Thanks. Thank you, everybody, for listening.
Yeah, thank you. Thank you very much, everyone. Bye-bye.
Bye.